Williamson there at Sheba Medical Center in Ramat Gan. Thank you for that. And for more, we're joined now by Professor Arnon Afek. He is the Deputy Director General of that Sheba Medical Center and the former Director General of the Israel Health Ministry. And he joins us from the town of Rosh Hashanah. Thank you for joining us, Professor Afek. Since we just spoke about the nurses, let me just start with that. Because, you know, even before the pandemic, there were complaints about nurses, about things about like working hours and stressful conditions. One can only imagine now. So what has to be done to perhaps relieve their load, make this more bearable for them?
Well, first, it's very important to note that the nurses are the main people who are taking care of the patients. So it is very, very important that we, as the health system, will support them and ask the Ministry of Finance to increase their numbers and to give us more positions. We learned, for example, that to treat 20 ventilated patients, you need around 20 physicians and more than 90 nurses. That's to give you the amount or the number of people needed to treat such a severely sick people under protective gears. So we need this stuff in order to prepare ourselves for the coming epidemic or for the winter, which is going to be even worse.
Right. Now, certainly there is the manpower issue that has to be addressed as this second wave surges. There's also the issue of how prepared hospitals are, both equipment-wise, and also I'm interested in, for example, treatment, like, for example, remdesivir that we've heard very positive things about. How prepared are hospitals with the stock they may need if this surge continues?
Well, it depends. Regarding the infrastructure, we prepared ourselves with the help of the Ministry of Health. So now we have enough places to put the patients. The problem is that first, we don't have enough staff, physicians and nurses, to take care of both the regular patients who are now coming to the hospital, unlike in the first wave. And the second, of course, the issue from remdesivir is an international problem. We know now to treat much better corona patient, which is a severely sick corona patient, which is very good news. We need for that steroids, which we don't. There is a sufficient amount of. Second, we do a ventilation quite late and try to postpone it as much as possible. This is not a problem. And the third issue is remdesivir. Now, remdesivir, we do not have enough because the USA, practically President Trump, decided to buy it all. So now I know that the Ministry of Health is doing extreme efforts with Gilead, the company that produces it, in order to get some stock and to bring it to Israel. It's very, very important for us.
Right. Now, what besides remdesivir, what other treatments have been proven effective? There's been so much discussion and even, I would say, debate over this particular issue. I mean, from what you see at Sheba, what other treatments may be effective and to some degree in treating coronavirus?
So what I said, the steroids, late ventilation, and remdesivir are the proven and most widely used strategies or treatments. We also use plasma taken from patients who healed up and have antibodies against the virus. So we use also plasma, pooled plasma, rich plasma in order to treat patients. We do not have yet large studies that say that it's helpful, although it is logical that it will help. There are other drugs that we are being tested now, and we still have to wait for large randomized clinical trials to tell us whether they are helpful or not. The issue of hydroxychloroquine, which was supposed to be a great promise, and even President Trump, as I said before, thought it's going to help many people. Unfortunately, it was not proven in large clinical trials, so we don't use it right now. But again, we're waiting for the results. It's an international effort in order to improve the treatment of corona patients.
Professor Afek, this falls more into health policy. The government today split on the issue of reopening gyms. Some people feel that there are perfect incubators for spread. Where do you stand on that issue, reopening gyms?
Well, first, the government is trying to balance between two different and many times opposing directions. One is supporting our economy. It is very, very important. I'm saying it myself as a health professional, because without economy, we won't be able to support the healthcare system. And the second issue is the rising epidemic, which by itself hurts our economy, but still we have to control it, also speaking about the patients who will arrive to the hospital. So you have to balance between them. And in order to balance, you have to have data. And that's exactly the problem. I don't know to answer you, because I still till now didn't receive or don't know what are the number of people who were identified in epidemiological studies that were infected with genes. You know the answer? I don't.
All right. Well, these are tough questions and tough decisions to be made. Professor Arnon Afek of Sheba Medical Center, thank you for joining us.
Thank you as well. And let's hope and ask all the people to join. If each one will do what we can do, like putting masks, keeping social distancing, and keeping hygiene, we can support the country of Israel in order to overcome the epidemic.
All right. Thank you for joining us, Professor.